Hello everyone and welcome back to my channel. In our last session, we discussed selecting the right impression material for different ridge types, including knife edge and ideal ridges. Today, we will focus on impression for flabby ridges and severely resorbed ridges. So what is flabby ridge? Flabby ridge is also known as fibrous ridge. Because of the resorption of underlying bone, the overlying mucosa becomes mobile and spongy. This is most commonly found in anterior maxilla region. So the aim here is to record the tissue in undisplaced stage so that it will not dislodge the denture. There are several techniques in the literature for flabby ridge impressions. We will discuss them briefly. The first one is one-part impression technique, where the final impression is taken in perforated customized tray. Second is the controlled lateral pressure technique for mandible posterior region, where green stick and light body is used for the final impression. Next is the palatal splinting technique where two trays are used. The palatal tray for the flabby ridge impression and the overlay tray for the impression of the rest of the ridge. Next is selective composition flaming with impression compound, where primary impression is taken using alginate impression material, and on the primary cast, impression compound impression is taken in custom tray, which was molded on peripheries intraorally. Next is the window technique, where zinc oxide eugenol and impression plaster are used for the normal and flabby tissue respectively. There are also some modifications of the window technique where light body and medium body are also used. This is the modification of window technique where perforations are made in the flabby tissue region and final impression is taken using medium body impression material. Next is the Zafarullah Khan technique, which is a modification of window technique where mercaptan and impression plaster are used, and in cases where labial vestibule is short, labial flange is removed. This is the two-part impression technique, the modification of window technique where light body and impression plaster is used. Another modification of window technique is where polyethylene sheet is heat pressed over the custom acrylic tray. This was basically to support the light body which is used for flabby tissue recording. Next is the modified fluid wax technique where fluid wax is used for recording rest of the ridge, and for flabby part medium body material is used. Then single impression technique where on the primary cast the perforated custom tray is fabricated and the heavy body material is used for recording the periphery and the light body material is used for the impression of rest of the ridge. So these are the techniques we have discussed for the flabby ridge impression. Moving to severely resorbed ridge. Due to the faster resorption at the crest of the residual ridge, it leads to severely resorbed ridge, flat ridge, or atrophic ridge. Extreme resorption ridge is generally seen in mandibular arch than maxillary arch, and the reason could be anatomic, metabolic, or mechanical. Primary importance here is stability and retention of the prosthesis to be delivered. Moving to the impression techniques for residual ridge impression. The first one is Winkler's technique, which is closed mouth impression technique. Here, tissue conditioner is used for the functional impression and final impression is obtained with light body impression material. In this modification of closed mouth technique, after recording the vertical dimension, the functional impression is taken with light body. Next is the dynamic impression technique by Tried and Olson, where three methods are given according to the different situations, where mandibular dynamic impression is taken by alginate in first two technique and by the tissue conditioner in the third technique. Next is the admix impression technique, where the main consideration was given to the impression material. Here 3:7 ratio used for the impression compound and low fusing impression compound. Next is the all green impression technique where low fusing impression compound was used. Now coming to cocktail impression technique. This technique utilized the custom tray according to dynamic impression technique. Material they have used according to admix technique, and they follow the functional impression according to closed mouth technique. So this is the combination of three technique, that is why the name cocktail was given. This is the flange technique by Lawton Levin, basically for recording the neutral zone by using the fluid wax technique, and here along with that the flanges of the denture are also recorded using the fluid wax. Roberto Vaughan technique where the tongue movements were given importance and modeling compound was used. Modified Fornet Tiller technique where minimum pressure technique is used. Anand technique where training of the patient before taking the impression was given importance. Next is the clean technique in which putty consistency material with the metallic core was used for the primary impression, over that wash impression is taken with light body. The vast amount of literature on impression techniques can be confusing. Based on my experience, the key is simplicity and consistency. For flabby ridges, use alginate for primary impressions. For secondary impression, use either single impression technique or window technique using polyvinyl siloxane material in different consistencies. For atrophic ridges, aim for stability and retention. Choose materials that capture the tissue's physiological state without overextension, and train patients in proper tongue positioning and denture stabilization. In summary, focus on simple and consistent techniques for reliable results. Thanks for watching, and don't forget to subscribe for more dental insights. Please do like, share, and subscribe.